Oration, and so this is the first time we are having our oration as well, and I invite Dr. Noori to introduce our oration speakers.
Good morning, everyone. On behalf of IACI, I welcome you all for this conference and the first IACI oration awarded to Dr. Bhavin Jankharia, who is a pioneer in cardiac MR imaging in India and has shown us everything, guided us, all of us, in learning cardiac MR. It's my proud privilege to introduce you our orator for today. On this beautiful day of October 13, 2023, the Executive Committee of IACI recognizes and felicitates the distinguished career spanning nearly 3 decades after Dr. Bhavin Jankharia. As a consultant radiologist, Dr. Jankharia, you have epitomized excellence in the field of radiology, leaving an indelible mark on the landscape of medical imaging. Your unwavering commitment to advancing the practice of radiology is exemplified by your role as a trustee of Radiology Education Foundation since 1996, and your advisory roles, including the ACR IAC. Dr. Jankharia, you have contributed significantly to the growth and development of radiology as a discipline. Your educational journey from MBBS at Mumbai University to your fellowships and training at esteemed institutions worldwide is a testament of your dedication to professional growth and development. With an extensive repertoire of academic contributions, including 5 books, 41 chapters, 76 articles PubMed listed, and 32 posters, you have been an invited lecturer at more than 1,500 events over the past 30 years. As the former editor-in-chief of IRIA 2007 to 2012 further underscores your impact on the academic community, your latest book, Computed Tomography of Interstitial Lung Diseases, published in 2019, reflects your commitment to advancing knowledge. Dr. Jankharia, your pioneering spirit is reflected in your subspecialty interests ranging from chest and bone radiology to interventional CT. Your service has not only benefited countless patients, but also have enriched the broader medical community. Moreover, your ventures into business of radiology and healthcare have positioned you as a thought leader in the industry. Your expertise in the field of cardiac imaging is exemplary, and the next generation radiology is blessed to have a teacher of your caliber to guide and mentor them. As a distinguished member of numerous professional associations and societies, both nationally and internationally, you contributed significantly to the global advancement of radiology. The legacy as a part of past president of IRIA and Indian Association of MSK Oncology Society attests to your leadership and influence. In acknowledgement of your outstanding achievements, we celebrate today Dr. Bhavin Jankharia as a luminary in the field of radiology, whose contributions continue to shape and elevate the practice of medical imaging. With your impressive body of work and unwavering commitment to the field, you are a source of inspiration to all aspiring and practicing radiologists. We salute your achievements and wish you success in all your endeavors. We pray to the Almighty to continue to bless you with a healthy, happy life today, tomorrow, and ever after, and present this citation to you with love, gratitude for being one of those masters in the field of radiology. I welcome Dr. Bhavin Jankharia to deliver his oration.
So, thank you for that kind introduction, and there were things you said which I didn't know about myself as well. Vimal, Priya, everybody in IACI, which is one of those babies that we founded, and everyone in the audience, thank you so much for all the love and affection that you have showered upon me at this point in time. And I shall talk about my journey, or so-called 20 years of cardiac MR. The only issue is, and I mentioned this in Hyderabad when you had given me a similar talk on cardiac CT, is that it almost seems like I'm being put out to pasture, right? I mean, I've been this kind of an oration and this kind of, these words that he's used means From the next meeting onwards, stay in the background, don't ask a question, don't involve yourself in any association activities and stay quiet, you're done. Now for the next 20 years, just don't say anything, right? Okay. So September 2003 was the first time that we started producing cardiac MR images on a 1.5T Sonata. And the reason I put this is because at that point in time, one of the holy grails was to do coronary imaging with MR. And we actually, for almost a year, kept doing, using three-point techniques, we kept doing proximal coronary artery imaging. And it's because of the 20 years, it's September 2003 now to October 2023, hence the 20 years of cardiac MR. But how did I get there and how did I get here? And the story pretty much starts in 87, 88, about 35 years ago. I joined as a resident in radiology in LTMMC, LTMG at Sion, Mumbai. This was in 88. All we had were X-rays, ultrasound, fluoro, so we learned what we could with these modalities, and so we would do angiograms, interventions, and then a lot of X-ray procedures, etc. No CT, no MR. No access to English music or Hollywood movies. We had cassettes, CDs, VHS. A lot of you don't know what I'm talking about, right? You've never seen these things. The only cars we had were Ambassadors, which were being phased out, Premier Padminis and Maruti 800s, right? My first love was an Ambassador and the second was a Padmini, and that's pretty much how we lived our lives. There was no internet, no cell phones. Dilwale Dulhania was still 7 years away, right? And that was the year when Madhuri, not her first movie though, but she became so famous with her Ek Do Teen. This was Amir's first movie as a hero. He was a child artist in Yadon Ki Barat, but otherwise, this is where he died with Juhi Chawla. So QSQT became big. And this was one of those bad movies of Amitabh. Kamala Hassan in Satya. And Bruce Willis started his big career with Die Hard, and of course today is retired, and he's been put out to pasture, right? That time, imagine, in 1987, on the 1st of November, the first MR in private in the country, the second MR in the country was commissioned at Breach Candy Hospital in Mumbai. The first was put up by Dr. Lakshmipati at INMAS in Delhi. That's another story entirely, but this was the second. So this was put up by Viral Shah. Viral had finished his MD radiology from LTMMC and from Sion. And it's important to understand that till Viral put up his MR, the only other individual who had, as an individual radiologist, put up any machine beyond an ultrasound was Dr. Sudarshan Agarwal in Delhi. Some of you may know Bharat Agarwal, his son. This is Bharat's father, right? And they are a third generation, Bharat's a third generation radiologist. So Viral bought a 1 Tesla MR. INMAS had the 1.5, and this was from Siemens, installed in Breach Candy. And he had to do this backward-forward integration. To ensure helium supply, he had a friend of his start a company called Pure Helium in Tarapur, which is a few kilometers from Mumbai, just to get everything sorted out. Why is this important? All the people here who are radiology entrepreneurs, who've put up scanners and diagnostic centers on their own, owe these people, right? Because it was Viral, Dr. Sudarshan Agarwal, and Dr. S.K. Sharma who put up the first ultrasound unit in, well, kind of almost the first in the country. He was at Echo Imaging in Kolkata, to the extent that when he used to do ultrasounds and nobody in 82, 83 knew what ultrasounds were, they used to tell people, "Wo Sharma scan karke leke aao." That was how the modality was being developed at the time. But the era in which this happened, this is called the license Raj era. right? You needed permission to import everything into the country. About 10 different levels of bureaucracy that you had to go through, the palms you had to grease to get all of that to happen. Today they are saying that the license Raj will come back in the next 5 years if the current government continues. I can get arrested for saying this today, but what the hell? So if this is not supposed to happen, it was there at that time, and despite all of this, they managed to do this. And so indirectly, because they did what they did, and I was lucky to have a father who is a radiologist still working, and I'm second generation, I had the courage and confidence of becoming an entrepreneur radiologist in '94. That's the business part. So where does the cardiac MR come in? So Dr. Om Tavri, who was my teacher at Sion, was one of the radiologists in the breech candy MR. And literally from the first month, he started doing anatomic cardiac MR. So what they would do is 15-minute sequences of anatomic axial coronal sagittal of the heart. This was done entirely for pediatric congenital heart. And then they would print them on those 8x10 films, do you remember, for ultrasound, and even in the past we used to do CT and MR prints on them. And he'd bring a stack of 40 or 50 films, then we put them up on the view boxes, and you had to put them in order. And then you went through them tracing IVC, SVC, RA, LA, RV, LV, etc. It was an interesting time. But on another occasion, please remember that the first radiologist to do any kind of dedicated focused cardiac imaging was Dr. Om Tavri, and perhaps at some stage in some forum, that recognition needs to come as well. So that was very fascinating. I also was a little intrigued by this article that Dr. Higgins had written way back in '85, and I'd read this when I was a resident, and I thought this is something that we need to get into. And this article in '85 talks of EBCT, and so CT, MR, PET CT, and pretty much everything that we do today was there in this article as a kind of future model. Anyway, then nothing happened in residency. Echoes and angios were done by cardiologists, so apart from some pericardial stuff and then looking at those x-rays with snowman's hearts for your exams for pediatric cardiac imaging, that was all we had to do with cardiac. So then I joined a hospital called Bombay Hospital. I was a senior resident for 3 years till '91, and from '91 to '93 or '90 to '93. And then in 1992, we got one of the first 1.5T scanners in the country. This was a GE Signa. And I spent the next 2 years doing nothing but sitting on console. It's an alien concept these days for residents. I don't think you know what it means to sit on console. But we sat on console, and Smruti is here from Hinduja. She joined me in the latter part of this, and we could run rings around the sequences. There were things we would do. We would produce some amazing images, take time, of course, but we learned. And all of that was important because you need to know how to run sequences, modify them, and work with them when you're doing MRs. Then I left for the US. I did a bone fellowship with Don Resnick, a chest fellowship with Steve Swenson at the Mayo Clinic. Came back, didn't have a job. So HN Hospital, which is today called Reliance HN, wanted to put up a CT scanner. And I didn't have anything to do, so I said, why don't I put up the CT scanner? I didn't know anything. I didn't know what depreciation meant. I didn't know how to calculate interest on a loan, because nobody teaches you any of that in med school. So you learned all that, and thanks to Dr. Sudarshan Agarwal's co-brother, and that's another story, we got a loan. Plus the economy had opened up. So in 1993, India was bankrupt, right? We didn't have any money. You couldn't go abroad. You couldn't spend anything. And Dr. Narasimha Rao was the Prime Minister, Dr. Manmohan Singh was the Finance Minister, and they just completely opened up the country in one shot. Today, it was like demonetization. Yesterday, everything was normal. Today, suddenly your money is worth nothing. That was different. Till, yesterday you couldn't do anything. And suddenly the next day, the economy completely opened up. It was a sea change, which, those of you who were there might kind of remember that. So then I became an entrepreneur radiologist, and then every year we put up some machine or the other, but the MR bug and the cardiac bug was still a little away. Remember that the field was progressing. So you've got all of these papers. Charles Higgins wrote this again in 2000, 15 years later, and he just kept adding on to everything that was happening. And then you had other papers from Dr. Abrams, who was also a leader, Dr. Boxt, who was a leader, and they kept putting up things of the possibilities that were there. Then the next person who made a huge difference to cardiac imaging and who's here in the room somewhere, Hemant. That's Hemant, by the way, in case you don't recognize him from what he looks like now. In 2000, he and Ajay Thakkar took this amazing risk of putting up a force slice and saying we will do cardiac imaging on this. And they started doing that, right? In 2001, I had a 0.2 Tesla MR, which I put up because I couldn't afford a 1.5. We were doing so well, I said I immediately want to put up a 1.5, but I was also running a spiral CT. And I didn't think a force slice was good enough for cardiac CT, but that was fine. At least he started it, and people got used to the fact that you could do cardiac CT in the country. So, the second person who made a difference to cardiac imaging after Dr. Tauri was Hemant. So anyway, if I had to do cardiac, I had to learn cardiac, so I went and did a fellowship with Dr. Dudley Pennell. This was a sabbatical for 12 weeks. I had 2-year-old twins. I just left them and went. It was an interesting time. Prior to that, I attended a NASCI meeting in Dallas in September 2002, which was a time when I actually met Sanjay as well, and he remembered that meeting. And I actually got up and asked somebody a question. I want to get into cardiac imaging. Should I buy CT or MR? It was such a stupid question, and I think they all looked at me like I was a fool from India. But I didn't know what to do. Anyway, decided to do cardiac MR. There were 8 fellows, 5 cardiologists, 3 radiologists. There were locals. We had a lot of fun. I learned how to use chopsticks, which I think is the most important thing I learned during the fellowship, because I came back and I could show off how I could use chopsticks. Nobody else around me could use them anyway. It was also an interesting time. I was alone, and that allowed me to kind of reset my life a little bit. That's when I got into working with my mind and my body and stuff like that. And so in September 2003, we started doing cardiac MRs. And the only other center doing CMRs was All India Institute. And I don't think even they were doing it in a focused manner. And to make the center viable, Meher Ursekar from Bombay Hospital, many of you know her as this exemplary pediatric neuroradiologist, joined us, and that's the only way that we could make this entire setup work. So it was this combination. Being an entrepreneur, wanting to do cardiac, these all came together in 2003, and we were able to start and kick off CMR in the country. Initially, we were doing 4 to 5 patients a month. It was all viability imaging. We had this comprehensive ischemic heart disease protocol where we would do adenosine stress plus viability plus coronary imaging for the proximal coronaries. And we did that for about a year. And then Hemant had upgraded to a 16 slice for the cardiac. And we thought we should get a 16 slice as well and see how the cardiac would go on that. But when I was trying to do the deal, Raghavan from Siemens came up and said, we have this new thing called the 64 slice. Would you want it? I said, I can't afford it. And he gave it, because we were going to be the first at a very good price. And we actually landed up being the first setup in Asia, one of 5 in the world to have the first 64 slice. And that was amazing. We beat somebody in Beijing by about 2 hours because of the time difference, and we flipped the switch a little earlier. But that was interesting. And the funny part was that we started doing 100 patients for cardiac CT per month from day one, and it was still about 4 to 5 as far as cardiac MR was concerned. But we persisted with CMR because my understanding of CT is still that it's a plumbing job, right? I mean, you have a pipe, it narrows, it expands, and that's about it. I mean, you could train anybody to read those. MR is a little more interesting, there's a little more physiology, a little more demanding, a little bit of learning curve. I wanted to do thalassemia work, but Imperial and Royal Brompton would not give me the multi-echo sequence. I don't know why. Until in 2007, and I was again in London for a meeting, I just kind of went and lost it, and I said, we have 150,000 thalassemics in India, and we still, even today, have 10,000 born every year, which is such a failure of our entire, healthcare system anyway. And I need to do this. It's important. Our hematologists want it, and they finally gave it, and that's how finally the work exploded. And then around 2007, 2008, the electrophysiologists with whom I'd been banging my head saying, we can make a difference to your hypertrophic cardiomyopathies, to patients who have, ventricular tachycardias, etc., they wouldn't do anything about it. They wouldn't send patients until they went to the ACC meetings in the US and came back and said, they kept talking of this new thing called cardiac MR. Bhavin, are you doing the same thing? I said, yes, that's what I've been trying to tell you for 4 years. Oh, no, we want to send, because now worldwide this is the trend. And I said, okay, fine, we're there, we're kind of all there. And so then slowly that work started building up. Now we'd already started the REF in '96, so we started organizing cardiac meetings, and then Hemant and I and all of us used to meet up. And at one such meeting in the late 2000s, a few of us decided to form an Indian society. So IACI was born around 2010, and Nori reminded me it was during a lunch in Ahmedabad during the annual meeting that we did this. This is a picture from the second meeting in Bangalore, and I don't see Nori and Mahesh here. They're somehow not present in the picture. I don't know why, but this is the group here that was kind of the founder group of IACI. Of course, Gurpreet is no more, he's no more in radiology, I'm so sorry. He's become a musician, that's his band, that's his passion. He doesn't do radiology anymore. Sriram is into MSK and Bode has disappeared. I think he's in Raipur, but I don't really know where he is. But the heartwarming part, and I saw this in the Jaipur conference in 2019, is that a whole new generation of you radiologists have taken over the running of the IACI, exemplified by Priya and the rest of you, and that's so amazing, because then this organization will continue to grow and live, and that's really how organizations should be. So anyway, continuing with the other journey, the Sonata worked for about 12 years. It was an amazing workhorse of a machine, and then in 2015 I shifted to a Philips Ingenia CX, and we've been doing all our CMRs there for the last 8 years. I think there is a photo of this book somewhere outside, and Priya wanted to write the book. I did some editing, so I assisted her a little bit in that, but it's all her work. And then we launched this site called mricardiac.com. And without fail, Thursday morning, there is a case that is put up, again thanks to Priya, because I've done about 26 of these. I do once a month, and then she does the rest of them. And it's all free, and there's such a lot of stuff, and then every week there's a new case or a new subject that gets put up. So that's kind of continuing to add on to what we are doing. So we've gone from 4 cases a month to a decent about 105 odd cases a month. Every year is a little better. Whereas cardiac CT is completely stagnant simply because every 6 months a new center is put up or a new hospital comes up, and while the work goes up, it keeps getting divided, so that number never really increases, right? The only regret, and even when Vanessa spoke about the 4 generations of cardiac MR, you see the development has been at a snail's pace. When I was working in, studying at the Brompton, we were talking of tracking for the aortic valve and the mitral valve on short axis, just so that you would be able to get the valves in the same images to be able to do better valvular studies. And the companies are not interested in R&D as far as cardiac MR is concerned to any great extent. So this is where we've reached. The only new thing that we have since in the last 25 years is multiparametric mapping and strain imaging. Everything else was already there. Maybe we've gone a little faster, maybe the temporal resolution's a little better, but that's it. Worse, in our country, even though there's interest, right, there are not more than 20 odd centers doing at least 1 CMR a day. Because there is a learning curve, which is not there with cardiac CT. And radiologists need to know how to sit on console and do a scan. If you cannot do a scan independently on your own, which is how we were taught at the Brompton, you do not know what those sequences are producing. Therefore, you do not know what the artifacts are, and therefore you do not know how to interpret every second opinion I do. And there is no exception. Right? Every 2 days I'm doing an opinion on a scan done somewhere else, and the LG images look like something out of Mars or Venus, right? Simply because you don't know what is normal, because you've not sat on console, you've not manipulated your TI times, you've not looked at TRT, and therefore the whole modality doesn't progress because the techs are not so educated, they do not understand. And so it is the radiologists who need to be sitting on console, and if you're not going to do that, this is where we are stuck. And so in a city like Mumbai with a population of 20 million plus, there are 4 setups, right, where any reasonable quality CMR is done, and only 2 setups do at least 1 CMR a day, or at least have a reasonable volume. And that's a disaster, right? When you have about 50, 60 setups doing cardiac CT every day with volumes going up to 10 to 15 cardiac CTs, I think MR needs to do much better, given that we've now been around for at least about 20 odd years. So this is what we're still doing. This is what we started with. Our indications haven't changed, but what we do has changed. We still do iron overload a lot, but we do more cardiomyopathies than viability imaging. Earlier, viability imaging used to be our bread and butter, but more and more, as time passes by, we do hypertrophic cardiomyopathies and tachycardias and all of that. So it's been an interesting journey as an entrepreneur, as a radiologist, as a teacher, as an organizer of meetings, and as a parent and a person. And I said this to Nori yesterday, and then I put in this slide after that, is that what keeps me going, and this is when you talk to people, a lot of people are disillusioned with medicine. So many people don't want their children becoming doctors anymore in this country because of the way the system works. But at 58, when I see people around me, my peers, my friends, remember the non-medicos are retiring. They're being kicked out of their jobs to make way for younger people, right, in the corporate sector, because you don't want a 58, 60-year-old and pay them a lot of money. They're not worth the effort anymore when you can get a 35-year-old who can work 16-hour days for half the price. Those in business now have children and grandchildren, so they're retiring as well. And a whole lot of people have no purpose in life, which is, you've still got another 30, 40 years. Statistically, all of us are going to live till we're 90. You know, and if that's going to happen, if you retire at 60, what are you going to do for the next 30 years of your life, right? But as a doctor, right, I get up every day, and I know that every working day, I am making a difference to somebody's life. Maybe sometimes for the worse, but usually for the better. But I'm making a difference. And how many people, how many professions, right? Maybe teachers can say that, maybe lawyers can say that, you know, maybe chartered accountants can say that. But we make a difference every single day, and that is a huge thing, right? So being a doctor, being a radiologist, I think these are amazing things to be, because, and many of you who are young may not get this right now, but the older you get, the more you will realize how fulfilling it is to be doing what all of us are doing. So that, ladies and gentlemen, is about my 20 years doing cardiac MR, 35 years doing radiology, and 58 years on this earth. Thank you so much for listening to me.
Thank you very much, sir. And I must admit, sir, you are not that old. And,
I'm not. I just don't make me feel old.
Because the one thing I learned from him is that keep on learning. Like the way he teaches us, I mean, every week there is a mail with a new article. The yesterday's post is by him. So it is all well versed with new concepts, and it is people like him that, you know, we are there here today. I request Dr. Telkar to come on the dais and to felicitate sir. Yeah.
One question.
Yeah.
God would have turned the clock backwards. Is there anything you would have done differently?
I've thought about this a lot, and I don't think so. I think I'm very happy where I am. Yeah, thank you.